Assalamu alaikum. I hope so you're all doing fine. I'm Dr. Muhammad Ali Rabbani and I'm with you with the next installation of the topic of neuroanatomy, that is the spinal cord. Today we are going to discuss the neuroanatomy of spinal cord in detail. We will start with its general structure with its features, then we will move on to the tracts, the ascending tracts, the descending tracts, and we will close by discussing the reflexes that are intersegmental tracts and the lesions that are produced in the damage of different parts of the spinal cord. So let's start with today's lecture. Structure of the spinal cord. Okay. By the end of this section, the student should be able to describe the structure of the spinal cord, its features, external and internal, describe the structure of gray matter and white matter in the spinal cord, and enumerate the major ascending and descending pathways, tracks in the spinal cord. So here is a picture from Snell's neuroanatomy, and by this we're going to start with this. Okay, let's start. Where does the spinal cord start and end? So as we have already discussed in the general anatomy of the nervous system, spinal cord is one of the two major components of the central nervous system, that is the brain and the spinal cord. So where does the spinal cord actually starts? So we have about the spinal cord starts from the junction between medulla oblongata and spinal cord. So how do we define that? We have a few logics for that. At the point where the spinal cord crosses the foramen in the skull, that is the foramen magnum, that point, or the point where we will see that in the upcoming lecture on the brainstem, where the corticospinal tract crosses the midline like this, that obliterates the sulcus that is present in the midline anteriorly. So the point where that decussation is present, where that crossing over is present, that point, or last but not the least, at the point where these first rootlets begin to appear, the first rootlets of the first spinal nerve, that is C1 nerve, that when they begin to appear, that point is known as the starting point of the spinal cord. There are other targets also, but these are the major ones that we will discuss. And with the end, the spinal cord ends at the lower end. That lower end is called conus medullaris. I have written it here also. Conus medullaris is the lowest most part, and it is the part in adults. It's a fairly constant position. It acts as the lower border of L1 lumbar vertebra, or the upper border of L2 lumbar vertebra. Some books prefer to say the disc between these two. And in young children and newborns, it is by the L3 vertebra. And as the person grows, the vertebral column increases in length with more speed as compared to that of the spinal cord, and leading to the lower end moving up from L3 to L1. Coverings. The coverings of the spinal cord, like all the other parts of the central nervous system, are three. The outermost, shown in the green in this picture here, is the dura mater. It is a tough one and it covers the outside. Then inside there is the pia matter, arachnoid matter, the second one, the arachnoid matter. Arachnoid, literally it means like a spider, or that arachnid group of the animals, and that is a sponge-like material that houses CSF. That in the shown in the blue here is the arachnoid matter, and the one that is intimately in contact with the spinal cord, that is the pia matter. That is very delicate layer that is in contact with the spinal cord, and it is shown in the pink color in this particular picture, and it follows all the contours and curves and sulcuses of the spinal cord. And one more thing that you can pick up on here is that There are extensions of the pia mater from the spinal cord that goes on the lateral aspect. These extensions are called denticulate ligament or ligamentum denticulatum. Of course, you can go into the further details in the topic of meninges when we are discussing that. The spinal cord, as you move along the length, you can see that on particular aspects they have a diameter that is more than the diameter of the rest of the spinal cord. Like this part, you can see this part has a diameter more than that of the rest of the part. This part has a diameter more than that of the rest of the spinal cord. As you can see, if you follow that, the spinal cord is extending beyond the ongoing average. So these parts are called enlargements. There are two enlargements. The one enlargement that is at the level of cervical vertebra starting from T5 to T1. There are different different books says C4 to T2 and C. This is from Snell's and it has seen C3 to T2 also. So these are the part where most of the motor neurons are present that are going to supply the upper limb. So because of that population, the diameter of the spinal cord has been increased in this point. The second one is this lumbar enlargement that is for the lumbar plexus and the sacral plexus or the major component of it L2 to S3, L1 to S3, and that is the part that gives rise to the nerves that will form the lumbosacral plexus and they will in turn go on to supply the lower limb. So these are the two parts where the in these two parts the spinal cord will have been enlarged due to the increased number of cells. Then there are fissures. If you can see anteriorly, the spinal cord is dipped inside. So this is called anterior median fissure. It is relatively deep as compared to the its counterpart that is the posterior median sulcus. That is the depth that goes from the midline from the backside. So that they are a very good landmark of dividing the spinal cord into the right and left half. Then parts that are going to discuss in the length. The parts of the spinal cord are only defined based on their presence in the particular part of the vertebral column or due to the curvatures of the vertebral column. So there are no inherent segmentation so that I cannot say that the spinal cord histology it's altogether different in thoracic as compared to the lumbar segment. Yes, there are some differences, but they are not very much defining for each of the segment. Like we will not see any abrupt change and will move from the last cervical to first thoracic segment. These segments, the cervical, as you can see in this picture, the cervical, the thoracic, the lumbar, the sacral, the coccygeal segments are being basically named for the spinal nerves that are going to exit these parts and are going to supply the respective areas. For the 8 nerves that are going to exit this part are going to supply the neck, the cervical region. The 12 are going to go to the thorax, the 5 are going to the lumbar region, the 5 are going to the sacral region, and the last one, the coccygeal level. The spinal cord, as you can see in this cross section here, it consists of both the gray matter and white matter. You must have gone through the video of general anatomy of the nervous system. There you saw that the gray matter, the one that is shown by this butterfly-like area in the mid, that immediately constitutes the cell bodies and their supporting cells. The outside, that whole area, it's the white matter. It appears lighter in color in cross section, in fresh specimen, and it majorly made up of tracts that are going up and down and between the segments. In spinal cord, as opposed to the brain, the gray matter is present inside and the white matter is present outside. Let us go through a few definitions, a few common features that we encounter them. What is conus medullaris? Conus medullaris we went through in the last slide. Conus medullaris, it's the last part of the spinal cord where the spinal cord end as a tapering end. Medullaris is the word that is used for the spinal cord. Conus is the word that is used as a cone. Conus medullaris, the cone of the spinal cord, is the lower end of the spinal cord, and you ideally should know the vertebral level. So this is L5, L4, L3, L2, L1. It is usually at the level of disc between L2 and L1. Of course, there are variations, normal variation between different individuals, but this is the most common one. Conus medullaris, and keep in mind conus medullaris is present at the level of L3 in children. Then is the term phylum terminal. Okay, before going into that, its meaning, let me build you a little background of embryology. Embryologically speaking, when you were in the womb, when the fetus was in intrauterine life, in the very early stages, in the second month, third month, the neural tube, the spinal cord that developed, was equal to the length of the vertebral column. Originally, it was all the way down to the coccyx. At that point, the pia mater that was covering the spinal cord got in contact with the dorsum of the coccyx bone. Even in the intrauterine life, as the fetus increased its length, the length of the vertebral column increased drastically faster as compared to the increase in length of the spinal cord. And due to that, the lower end of the spinal cord continued to move up until it reached the L3 level at the time of the birth. So that is what is visible right here. You can see the pia mater remain attached to the coccyx, and as the spinal cord goes up and it gets extended and elongated, so this whole extension of thread-like extension of the spinal cord of the pia mater, excuse me, that is running between the conus medullaris and all the way down to the dorsal aspect of the coccyx. This is called phylum terminal. So phylum terminal is a pia mater extension. Then comes another word that is cauda equina. Cauda means tail and equina means horse, horse tail. So cauda equina, it is a very interesting thing. As you can see, the spinal nerves exit all the intervertebral foramen. Between L1 and L2 or 5, there are 5 lumbar nerves, there are 5 sacrospinal nerves, and there is coccygeal nerve. But the spinal cord is ending at the level of L1, L2 disc. So where do all the other nerves come from? So what happens is that the nerves that are bound to exit those levels have already exited the spinal cord, and they will travel down and they will move out. And you can repeat this for all the 10 pairs. The nerves will travel down and they will move out. The nerves will travel down and they will move out. So if you continue to draw these nerves all the way down to the coccygeal nerve, you will see L2, 3, 4, 5, S1, 2, 3, 4, 5 coccyx. At least there are 10 pairs or 20 nerves, and all of these nerves will leave the lower end of the spinal cord and they will move down until the last one leaves the coccygeal part here. So these bundle of nerves as shown here and as shown here, these bundle of nerves are known as cauda equina. They make a bundle like a horse's tail. And one more piece of information that is frequently asked from you in the examination is the lowermost extent of the arachnoid matter and dura matter. You can see the lowermost extent of the dura matter and arachnoid matter is here. This is S1, this is S2, and this is the part where the dura matter and arachnoid matter ends, and this is the part where CSF ends, or the lowermost part where the CSF can go to. So this is the part that is usually asked in the examination about CSF. So what is the relationship of the segments with vertebral column? So as we discussed it multiple times now, that with the increasing length of the body, the vertebral column increased with much more length, with much more velocity as compared to the spinal cord that left to the lower end of the spinal cord at the level of roughly L1, L2 disc than the vertebral column. So that means as you go down in the beginning, the nerve that is exiting the spinal cord, it's roughly leaves the spinal cord at the same level as it is exiting the vertebral column. It is roughly horizontal. As you go down, you can see this picture. Let me move myself here. As you go down, you can see the spinal nerve have to slant down a little, then exit. As you move down, you see it has to slant down as much as a vertebral body before it exits the spinal nerve. Two vertebral bodies, multiple vertebral bodies before it exits the nerve. So that piece of information becomes very important when you are dealing with spinal cord injuries. For example, a person comes to you with a fracture of L3 vertebra, or let's say, let's make it simple, a person comes to you, this picture is not up to the scale, keep in mind. A person comes to you with a fracture of, let's say, 10th thoracic vertebra. Now, which segment of the spinal cord has been damaged? Because as you know, the nerve of the T10, it exited the spinal cord at the level somewhere above than the vertebra T10. So this formula that helps to you for the cervical vertebra, if you damage for all the cervical vertebra, there are 7 cervical vertebra. If any vertebra body is damaged, let's say C5 is damaged, then the spinal segment of AD1, spinal segment of C6 nerve will be damaged. For the thoracic vertebra number 1 to 6, let's say if the thoracic you have to add 2. If the thoracic vertebra number 5 is damaged, then the spinal cord segment T7 will be damaged. Same you will do for next 3. For thoracic vertebra number 9, spinal segment number 12 will be damaged. For the 12th thoracic segment, L1 to 11th thoracic segment, L3 for 12th thoracic segment, L5, and first lumbar vertebra will lead to the damage of coccygeal and sacral segments. So this information ideally you should keep in mind so that you can answer when a person coming to you on trauma, with trauma, you can estimate which spinal segment will be damaged. Let us dive into a little more detail regarding the gray matter of the spinal cord. The gray matter of the spinal cord, as you can see in this picture, the gray matter, it's like a butterfly. It has this anterior extended portion. This part is called anterior horn. That is the posterior extended portion. So this part is called dorsal horn. Anterior horn is also called motor horn or ventral horn. Posterior part and dorsal horn is also called the sensory horn. And then there is this intermediate part here. This is the intermediate part, and this intermediate part, it extends a little onwards. This part is called lateral horn, and that is called the anterior intermediate part. That leaves us with the horizontal bar of the edge that joins the two parts of the butterfly, that is called the commissure, that crosses the midline, that is gray commissure. And if you can appreciate in this picture, in the midline you can see a little dot here. So this canal that contains the CSF in the center, that is called the central canal. For each part, you should keep in mind that the relative size of the gray matter, it is directly proportional to the number of cells that are present in them, and the number of cells present in them is proportional to the number of muscles that are being innervated by that segment. So you will see cervical and lumbar enlargements because at these areas there are a large number of muscles being supplied for upper and lower limb respectively. Let us dive a little deeper into the anterior horn. So these are pictures from Snell's Neuroanatomy, and these are the representative pictures from cervical, upper cervical, lower cervical, thoracic, lumbar and sacral segments. I don't want you to be overwhelmed by the whole picture. I just want you to be fixed with these dilated areas, these marked areas. So I will be discussing these three, the orange shown in orange here, these three markings I will be discussing here. So the anterior horn contains the cells. Let us discuss which cells are present. Of course, this is a simplification, but that is what we need from the clinical aspect right now. The exiting nerves that are going to supply the muscles are of two types, the alpha efferent and the gamma efferent or in other words, that are called alpha motor neurons and gamma motor neurons. The alpha motor neurons are those cells that are going to supply those part of the muscles that are going to bring about actual contraction, that are the extraphysical part of the skeletal muscles. These are the alpha fibers. Alpha motor neurons have larger axons and they are going to supply the major bulk of the muscles. Then the gamma effect. Each of the muscles of the body contains a sensory organ, that is the muscle spindles, that is very sensitive to the stretch and tension, majorly stretch and movement of the spine, that muscle length. And that muscle spindle is a specialized form of a muscle tissue, and these are called intrafusal fibers. Those muscle fibers are called intrafusal fibers. So the gamma motor neurons, the gamma efferents, are those part of the exiting neurons that are going to supply the muscle spindles, and by supplying that, they are going to discuss the that are going to adjust the sensitivity of the spindles. Then let us discuss these three groups. Very lucky for us, the names are very simple. The one that is nearer to the midline is the medial or central one, or the medial one. The one that is away from the center is the lateral one, and in between them there is an intermediate one. So medial one, as the common sense will dictate, the medial one is the one that is present near the midline, and it will supply the muscles that are near the midline. It is going to supply mostly the axial muscles, the muscles of the back, and the muscles of the neck and trunk, the axial muscles of the body, and that will be present in all the parts of the body regardless of the enlargements or not. The lateral group. What is most lateral in your body? Which muscles are most lateral in your body? That are your limbs. In the upper part there are upper limbs, in lower part there are lower limbs. So these will be developed in most for the parts where brachial and lumbosacral plexus are exiting. In other words, they will be more present, most prominently present in the cervical enlargements and lumbosacral enlargements. Third, but end is the central or the intermediate parts. These are not very regular segment, and these do not supply a very defined group of muscles. For each segment, they may be giving supply to a specialized group of muscles. For example, in the very beginning, in the very start, C1, C2, C3, C4, C5, that central group, that intermediate group is supplying the supplying the trapezius muscle or sternocleidomastoid muscle, that is giving rise to the spinal part of the accessory nerve. Similarly, as you move down from the C3, C4, C5, that nucleus is going to supply the diaphragm through phrenic nerve. And similarly, there are corresponding nuclei in the lumbosacral region that have some unknown supply areas, most probably to the urogenital system. Moving on to the posterior horn. Posterior horn can also thought of having multiple nuclei. These nuclei, we will be discussing four nuclei as we move from back down. Before going there, I will let me discuss one more thing. If we see the spinal cord like this, let me make a spinal cord like this. And in the spinal cord, we will have the dorsal, this gray horn, gray matter. It's ventral, lateral, dorsal horns. We will see that these are divided into multiple layers. So these are called laminas, rexed laminas, 1, 2, 3, 4, 5, and 6. And then there is 7, 8 right here, 9 somewhere here, distributed like this, and 7 in between them. 6 is somewhere here. I don't want to go into the detail for this particular topic, but I want you to make an idea that the back ones, when you are in reading, when you find out about Rex laminas, the initial one about 1 to 6, these will be more majorly concerned with the dorsal root or the sensory root. The seventh one, if I discuss in the lecture, that is the intermediate zone, and that contains a lot of fiber from the sensory system, but it is the intermediate area between the posterior horn and the anterior horn. And the 8 and the 9 one, and that are the ones that are present in the anterior most aspect, and that contains the motor neurons, and that are present in the ventral root. So giving that, let us move on to the nuclei. Then there is substantia gelatinosa. Substantia gelatinosa, it's the most back one, the one that is near the tip, roughly majorly present in the lamina 2, and that is the one that contains the cells that relay the pain touch temperature as it coming from the outside, and it will relay here and move up through the spinothalamic tract. Then there is a nucleus proprius. Nucleus proprius is the one that is present just below the substantia gelatinosa. Below would not be a proper word. Deeper to the nucleus proprius or anterior to the nucleus proprius, shown here, here, here. It is one of the largest nucleus present right here. The nucleus proprius is chiefly concerned with, okay, the nucleus proprius. It is its function. It's a little controversial. You will see different information about it in different books. This particular piece of information that I have mentioned here is from the Snell's Neuroanatomy, that it is associated with position, movement, two-point discrimination, and vibration. And in the Gray's anatomy, it discusses that these are majorly responsible for responsible for these are majorly propriospinal nuclei. These are prospinal nuclei. It means these are the nuclei whose axons are going to connect the different segments of the spinal cord. So they are majorly responsible for mediation of intraspinal coordination. Please excuse my writing. So this is about nucleus proprius that is present throughout the length of the spinal cord. The next that comes is the nucleus dorsalis, the Clark's nuclei, Clark's column, and you will also read about them as thoracic dorsal nucleus, dorsal thoracic nucleus. So these are present in majorly in the thoracic and lumbar segment. Some books will say T1 to L2, and other books will add one or more to them. So the Snell says CA to L3. So it is present somewhere right here, just in the medial aspect of the intermediate zone, the lamina 4, lamina 7. So this is the substantia, so this is the Clark's column. So you can see the Clark's column, it's present. You can only see the Clark's column in the thoracic segment. It is not visible in the cervical segments. It is in the lumbar segment. It is not visible in the sacral segment. So this is the one that is actually a relay center for all the proprioceptive, all the position, tension, muscle length movements, and the info from the skin that relays through this nucleus while on the way to going to the cerebellum. Then there are visceral afferent nuclei. These nuclei not shown in this particular picture are present just medial to the Clark's nuclei. They are present right here, just like where my pointer is, and they are going to act as a relay center for the visceral sensation from your stomach, from your intestine, as they are going up to the brain. Lateral horn. Lateral horn are the part that is this part, that is this extension that is going outwards from the lateral aspect of the gray column, and that is not present in all of the length of the spinal cord. As you can see in this particular picture, it is not present in the cervical. In the lower cervical it is present, in the thoracic it is present, in the third lumbar it's almost negligible and not present. So its presence, it's almost the same root values as the one that you studied in the Clark's nucleus, T1 to L2. These are present there. And why they are making an extra? Because they are being made by a population of cells that are going to give out the sympathetic signal. These are the preganglionic sympathetic cells that are accumulated right here, and their accumulation creates an output dent in the spinal cord right here. Then lateral horn cells are also present in the sacral segment of the spinal cord shown here, and here also the presynaptic parasympathetic cells are present, but you have to keep this in mind. The horn is not physically formed, and that is why the newer books try to avoid the word horns rather than using the word intermediate zone, because the intermediate zone of T1 to L2 contain presynaptic sympathetic, and that of the S2 to S4 contain presynaptic parasympathetic. However, only in T1 to L2 these cells are enough to make an outward projection as a lateral horn. Then let's talk about the central canal that is present in all the segments of the spinal cord. It is present within the gray commissure of the gray matter of the spinal cord, and this is the part, this is the cavity that contains the cerebrospinal fluid, and it extends all the way up from the cavity of the brainstem, the cavity of the medulla oblongata, that is the ventricle, and downwards it comes all the way down to the terminal ventricle in the conus medullaris. It extends a little, and that is the conus medullaris. That expanded part of the CSF containing cavity is called terminal ventricle. Inside it is lined by columnar cells, epithelial cells. These are called ependyma. Technically speaking, those are not epithelial cells, so avoid using that word. And in front of it is gray commissure, anterior gray commissure, and back to it there is posterior gray commissure. That leaves us with the white matter of the spinal cord. We discussed the gray matter. Let's discuss its three parts. These are the posterior roots, dorsal roots. These are the anterior roots. So they will be defining the three white columns. All anything from the midline, anterior midline, that is anterior fissure, all the way to the anterior roots. This is called anterior funiculus, anterior column. Everything from the posterior root all the way in front to the anterior root. This is called lateral funiculus. And everything from the posterior midline all the way to the posterior root, it's called posterior funiculus. This contains a number of tracts that we are going to be discussing in our next segment of the video, and these are called the tracts. This half of the picture shows, this is the picture from neurosnell sensory, and this half shows the motor tracts. So you can see in the dorsal white column we have fasciculus gracilis and cuneatus, and these two are part of a common tract that we are going to study soon. This is called dorsal column medial lemniscus system, DCML. And then in the blue that are shown, these are the spinocerebellar tracts. These are anterior and posterior spinocerebellar tracts. The ones shown in the red here are the spinothalamic tracts. Just medial to the anterior spinocerebellar is the lateral spinothalamic, and just anterior to the anterior horn is the anterior spinothalamic. Then there are other minor tracts, include spino-olivary, spino-reticular. There is also spinotactile tract there, not shown in this particular picture. On the other half, on the motor aspect, actually each half contains both of them to simplify the picture to avoid crowding. These are shown like this. These are the two major tracts are the corticospinal tract, lateral corticospinal tract, and anterior corticospinal tract. These are the ones. Then there is a rubrospinal tract just in front of the corticospinal tract, and then there is a tectospinal, vestibulospinal, olivospinal. It makes me easier to remember TIVO. Tectospinal tract is present here, In the anterior column, anterior funiculus. In the junction of anterior and lateral is the vestibulospinal tract, and in the medial most part of the lateral funiculus there is olivospinal tracts. So these are the different tracts that we're going to discuss in the next segment. These are going to be ascending, descending, and intersegmental. The intersegmental tracts are shown right here in the blue purple color. These are the ones that are immediately in contact with the gray matter of the spinal cord, and this surround throughout its length. So these are called interspinal and intersegmental, and these are also called propriospinal, and these are moving up and down connecting the different parts of the spinal segments. So almost that is about it. And these are the few pictures from Kaplan's Neuroanatomy, just to give you a brief overview to our reality check of how much we have done. So here we discussed about spinal cords, its gray matter, ventral root, dorsal root, lateral horn containing Clark's nucleus, intermediate zone containing Clark's nucleus, and intermediate zone containing T1 to L2, sympathetic, S2 to S4, parasympathetic. We talked about ventral horn giving rise to ventral root, dorsal horn getting receiving the dorsal root, and these motor and sensory roots they join to form a common mixed nerve, and that further divides into the ventral and dorsal rami, supplying the anterolateral part of the body and back of the body. We discussed about the gray and white matter, the different funiculi, the different coverings, the dura matter, the arachnoid matter, the pia matter, and we saw the fissures, the funiculi, and these things. You can just pause the video here and check if you have missed anything. And these are the definitions that you must be very frequent with it for now. The conus medullaris, the lower end of the spinal cord, called equina, filum terminal, dorsal root ganglion. If we have not discussed it yet, these are the cells. The sensory nerves that are entering the spinal cord have their cell body situated outside the spinal cord, and this aggregation of these cell bodies is called dorsal root ganglion. Ventral roots, dorsal root, horns, spinal nerves, cervical enlargement, lumbar enlargement, and the terminal part of the arachnoid. So that's about the general introduction of the spinal cord. In the next video, we are going to discuss the ascending tracts. If you have any questions, feedback, and suggestions, please let me know, and tune in for the next video, that is the ascending tracts. Thank you.